Host guests and callers, and not necessarily those of this station, its staff, management, or sponsors. Welcome to your Hometown Health Show, brought to you by Trilogy Home Healthcare, the industry leader with over 30 years of experience in providing home healthcare services such as skilled nursing, physical and occupational therapy, home health aides, and other specialized care to your homes throughout the state. Please tune in every other week as we bring you a range of good information from specialists in the field to help make you more informed and living healthy.
Welcome and good evening, everyone. You are listening and watching your Hometown Health Show. I'm Yolanda Santana, your host and owner of All Bits Tech. Tonight we have as our special guest, Dr. Daniel Travani, MD, and is also, as you know, sponsored by Trilogy. We have Jennifer Garrity and Liza May from Trilogy. Welcome, everyone. Good evening.
Hi. Thanks for having us.
Hi. How are you?
I'm great. How are you?
Very good. Thank you. Pleasure to be here with you.
We're so happy to have you. So before we get started, Liza or Jennifer, if you could let our listeners and viewers know a little bit about Trilogy and how we work with our partners.
Well, Trilogy Home Health is a Medicare certified company. We do a lot of what other home care companies do, which is we have nursing, we have physical therapy, we do also occupational therapy, speech therapy, but we also do psychiatric nursing, which is an important topic, and I think we're going to be covering that today. So it's one of the things that a lot of home care companies really don't do, but we find it very important, especially in this time that we're going through this pandemic, and especially after these news that we just heard yesterday about Florida is probably the next epicenter right now in the States. So mental health, people have been in their homes since February trying to cope with this pandemic. So that is very important to us. And we have certified psychiatric nurses that are ready and willing to help, the patients and keep them as sane as possible. So.
Thank you for that.
As you know,
and like I said, go ahead.
Go ahead. No, it's been very overwhelming for a lot of the patients that we've been seeing because, as you know, in a lot of the senior living communities, they're not able to see their loved ones or have visitors come in. So as much as it's challenging for them, it's challenging for our clinical services as far as being able to reach them and making sure that they're feeling comfortable with us coming in. But we've been able to reassure them and make certain that we can deliver the services that they're looking for, and making sure that we nurture their mental well-being and make sure that their immune system stays strong. And we want to make sure that we're doing everything possible with our psychiatrists, our physicians, to make sure that they can live a degree of normalcy in their homes.
Okay. So Dr. Travani is our special guest. Please, why don't you start telling our listeners a little bit about yourself and your practice, Dr. Travani, MD, and Associates.
Well, thank you very much. It's good to be here, and I appreciate the invitation. I've been in private practice since 1988, mostly based in Tamarack, which is in West Fort Lauderdale. And I have an outpatient practice, and I also see patients in the hospital and in what we call a PHP, or partial hospitalization program. I have another office in Boca Raton as well. And in the office, it's myself. I partner with a group of residents who are in training to be psychiatrists, and they're associated with the Nova Southeastern program in Davie. So I usually have a few residents helping me in the office, some of the residents helping me in the hospital. I also have a fantastic nurse practitioner and a group of therapists in the office, and we all we offer different services. I myself am mostly a psychopharmacologist, and so I do mostly evaluations and medication management, and I defer to therapists that are in the office to do the psychotherapy. Although here and there I do some psychotherapy. And we've been together as a group, and including Jennifer, who works with Trilogy. I've worked with her now for over 20 years, and it's the relationship we have is incredible, because I know that when I recommend her to go see a patient of mine, whether this patient is in one of the adult communities, whether it's an an ALS, or a skilled nursing facility, or a private home, or a condo, or whatever, she always goes and brightens up their day. I always regard her as a human antidepressant, because she goes, and no matter how depressed they are or how they feel, she always cheers them up. And then she gives me a lot of information back, and we work together as a team.
That's really wonderful.
I can tell you that, yeah, it's been a great relationship and partnership with Dr. Schiavone. And like I said, I've been had the pleasure of seeing his patients for the last 20 years, but believe me, he's mentored me as far as how to clinically screen our patients when I go out to the patient's home or the senior living community. We have a question ourselves with Trilogy in our assessments as far as, does the patient feel restless? Does the patient feel apathetic? Is he, suffering with poor appetite? Does he have those feelings, those negative feelings that are bringing him down, and he no longer has purpose, and he does no longer want more? So it's at that point where Dr. Schiavone and I developed a treatment plan along with, our other skilled clinicians, because a lot of times when these people are expressing any type of depression or they're feeling down, they're not getting out of bed. So that's when we bring our specialty clinicians. That means the occupational therapist who's helping with their activities of daily living. They're doing a home safety assessment for the client. We bring in our physical therapist to make sure that they're utilizing their motor functions well with their adaptive equipment, if that's a walker or a cane. We want to make sure they have all the resources available to them so that we are able to attain that the best quality of life that they so deserve. And, when you're feeling depressed, you need that special ability to care and be empathetic and tell them that your days are going to be brighter. It may take a while because it's not a quick fix. It's not like they broke their leg or, they have hypertension. It's a brain chemical imbalance that needs attention. And we're there to stroke their nerves, and basically it could be through an antidepressant that they need, maybe an anti-anxiety, or it could be just counseling. And Dr. Schiavone's office offers all those resources. And, due to the pandemic right now, it's a little bit more challenging, and Dr. Schiavone has that capability of doing the telehealth. And, like you said, it's not that same, warmth, but certainly Dr. Schiavone has that. He's very good. He's very calm. He's reassuring. He can be very direct when he needs to be direct with patients, to sort of like have them pull them up by their straps to get up and out of bed and get going again. But we're there to support them in any way, shape, or form. And that's why I feel that, Trilogy just does such a great job as far as providing that attention and the specialty services. And I'm proud to say that, our mental health, behavioral health program really does great things with our clients, and we make sure that they reach their best outcomes.
Thank you for all that. Dr. Schiavone, can you tell our listeners what insurance you take and what are your hours of practice?
Sure. Well, I am a Medicare provider, so I accept Medicare. We also do United, Cigna, Blue Cross Blue Shield, PPOs and HMOs. We are open from 9 to 5 at this time, and available by by phone if necessary afterwards.
Okay, wonderful.
But 5 days, work 5 days a week.
All right.
And, depending on the situation, um, if somebody's in a pretty dire situation, we'll try to get them in as soon as possible. Like either myself, my nurse practitioner, we'll get them in and get them assessed and try to at least get a treatment plan going.
All right, that's great. So we're just going to take a quick commercial break. We will be right back after these messages. Stay tuned.
Thank you.
Trilogy was established in 2016 by industry experts with over 30 years in home health care operations spanning 30-plus counties throughout the state of Florida. With offices in Jacksonville, Port St. Lucie, West Palm Beach, we strive to provide the most optimal care to our patients in a fun, forward-thinking environment. Our focus is on personal relationships, whether with an employee, a patient, or an outside community. Because we know that when people enjoy what they do, it becomes why they do it. Call Trilogy today at 954-689-6660 and ask for more information. In addition to offering the standard mix of services, SN, PT, OT, speech, MSW, and HHA, we also take great pride in being on the cutting edge and offering care and education to our licensed clinicians in other areas most agencies likely don't offer. Emotional and behavioral health with our psych nursing, biofeedback for bladder incontinence and pelvic pain, chemotherapy, IV hydration, antibiotic and respiratory therapy. Call today at 954-689-6660. Trilogy Home Care. You have been listening to the Trilogy Home Health Show, and if you wish to be a guest on our show, please call us at 561-670-9213 and let us share your knowledge and information with our listeners. Trilogy Home Health Care Show enjoys serving the community and bringing doctors and facilities of interest to help educate and inform the community. Please call us at 561-670-9213 and let us put you on the airwaves with the Trilogy Home Health Show.
Welcome back. You are listening and watching Your Hometown Health Show, sponsored by Trilogy. And as our special guest, we have Dr. Daniel Trevani from Dr. Trevani and Associates. So we were talking a little bit about insurance and what payments you take, as well as your hours of operation. And I think Jennifer covered a lot of the services that you provide. Is there anything she didn't get to mention you wanted to talk about?
Well, we try to avoid it at all costs, but if psychiatric hospitalization is necessary because the patient is so severely ill, or they're psychotic, or they're suicidal, my office is on the grounds of University Pavilion, which is a private psychiatric hospital, and they have 4 units there that for different adult populations. And they also have an outpatient PHP, or partial hospitalization program, which is a day program that runs from 9 a.m. to 2 p.m. 5 days a week. And they're running even during this COVID crisis, taking social distancing and doing whatever they need to do to keep the patients safe. So those are 2 services that are there if necessary. We try to avoid it at all costs, try to keep people out of the hospital at all costs, even if we have to see them once or twice a week during a crisis situation. But that's available as well as the office setting.
All right, that's really good to know. I think mental health is so important, and I don't think that we talk about it enough in this country. So it's fantastic that you offer the telemedicine, and can you tell our listeners a little bit more about how you've adapted those changes with the pandemic?
Sure. Well, there are different types of telehealth that we use in the office. Some of our patients aren't computer savvy, or they don't have iPhones or even FaceTime, and so they basically have a telephone. And so we'll and with those type of patients that feel comfortable using the phone, we'll do phone sessions. And in fact, a lot of those patients feel very comfortable doing that. They'd rather do that than take a chance in going out into the community, walking into a medical office building or any office that has potential for exposure to the virus. So we offer that. I do FaceTiming with my phone or my iPad, and we have electric medical records, that electronic medical records, which allows us to use a software on the computer that the patient has to download. They have to be a little computer savvy in order to do that. But just like we're doing now, we can easily do a computer or telehealth sessions on our monitors. Uh, so we're trying to do that all day as much as possible, and I think the patients really appreciate that because it's less stress for them having to worry about getting potentially exposed or infected.
I think it's wonderful. That's great.
Can I just add something with that? With him being able to do the telehealth and being able to communicate with his patients, he's still able to use the behavior team with Trilogy as far as being that liaison and being able to go out to see the patients home, because we are following the CDC guidelines. We are using PPE equipment and being tested and making sure that they're feeling the patients are feeling safe as well, because they want to see people. But now are trying times and challenging times, and we want to alleviate their anxieties, but also be able to treat them and make sure that they have those medications. They are taking them correctly. We are looking to see if they're having any side effects, because Dr. Schiavone, he's able to get what the assessment over the phone, but to actually really understand it more clearly, I think it's really important in these days that we're still able to go out and see the client on a one-to-one basis, because I feel that they're feeling more comfortable and in their feeling their depression or feeling anxious. So we're able to bridge that. So there's still that human connection I feel is so valuable during these times, because staying positive and optimistic during these times of crisis is certainly challenging, but we want to be still nurturing their self-esteem, their well-being. So we want to make sure that they're practicing exercise, they're practicing positive thinking, they're relaxing, they're doing some deep breathing, just sort of to make sure that they still are human and they're allowed to have these feelings. But when it's time to, they're really feeling really depressed, that's when Dr. Schiavone, has those expertise really to reach out and to treat them with either antidepressants, anti-anxieties, and educate them that it's okay to go through these feelings, because mental health, it's come a long way, but people still need to be educated on it, and it's something to be ashamed of. It's
No,
there and it's real, and we're all scared.
Yeah, it's patients, these are, previous patients that have had issues that have been treated, for different reasons. But now that we're going through this, it's been months, it's been pretty much, I think in Florida, they started to give it importance in February, maybe. And so even us that have not been through psychiatric, treatment, we're all, it's very, pressured. You start to develop anxiety because you can't do what you normally do. You're going through a different period where, sorry, you're going through a different period where, you are very anxious. You're changing your routine. The people that live in, the ALFs that I visit, the nursing homes, they're not even letting the family members in. They're not letting anybody in, and so it's very isolating. So there's a lot of depression going on. There's a lot of opportunity to help these patients that are going through these difficulties of adjusting to this. You know, we all are human. We all need human interaction, and that is not an option right now. So right now, you know, we need that reassurance that this is something that's going on right now, but this is something that's going to pass. So I think in terms of them, in terms of us, as being, you know, normal. Not, I'm not saying that they're not normal, but being just people in our society, being human. You know,
Right.
we're just, you know, we're all adjusting. I think we all could benefit from mental health. So
Yeah, I agree for sure. Dr. Trivani, two questions. What is the population you typically serve? And then also, if you could tell our listeners why stress during an infectious disease breakout can lead to fear, worry, sleeplessness, worsening of chronic health problems, increased use of tobacco, drugs, and alcohol.
Okay, well, those are good questions. First, let me say that you know what you were just talking about is absolutely very important. What you guys offer sometimes is life saving. I deal with a lot of the elderly population. My office in Tamarack is near a lot of retirement communities, and just imagine seniors living alone, widows by themselves, and you know afraid to leave their apartments and isolated and not being able to see their family, or their families live up north and they're alone. And so what you guys provide is essentially a life saving sometimes when you show up and give them a human contact and somebody safe to show them what they could do, what they should do. And I have a lot of patients that have benefited from what Trilogy and Jennifer has done over the past few months. I do treat the elderly population, but I have adult patients, basically 18 and up, and pretty much all of the entire population is affected by what's going on right now. A lot of people have been laid off, out of work, are at home, trying to keep their families' spirits up. Uh, Some of them have been at-home teachers trying to teach their children while the schools are closed. There's just a lot of stress, a lot of uncertainty with what's going on. It's exasperating. And after all these months, we essentially realize now that we haven't moved forward. In fact, we may be back at square one, or even worse than that. And it's very frustrating. And people are some people have become hopeless because they just feel that things aren't going to get better. They don't get any real clear information from our federal government, and they get some confusing information, which makes them feel as though they're not sure what to do. So they're looking to us to be the ones to give them the hope and the direction of what to do. And frequently it's just the basic stuff.
We're running out of time. Please let our audience know how to get a hold of you, as well as Trilogy.
Okay. Well, my office number, 954-720-7999. My email is shervoniassociates@gmail.com. And Jennifer, for Trilogy,
Go ahead.
I don't know your number.
They can just reach me at Trilogy, and the phone number there is 954-689-66.
Thank you both so much for joining us this evening. Thank you, Liza. And I hope you both have a great evening and stay safe.
Thank you, Dr. Schiavone. Thank you.
Thank you, Yolanda. Thank you, Doctor.
Have a good night.
Bye,
care.
Jennifer.
Trilogy Home Healthcare invites you to call our offices before making a decision about your home health and rehabilitative care. Different from other agencies, Trilogy offers specialized service that other agencies don't, providing exceptional care. That's who we are and what we do. Call us at 866-599-4959 or go to trilogyhomehealthcare.com. The opinions expressed on the